I'm Amber. I'm a registered dietitian nutritionist, and this is part three of the nutrition assessment lecture series. And here we are going to be looking at conducting a nutrition assessment step by step. The objectives for this video would be to outline so that students should be able to outline the steps in conducting a nutrition assessment, differentiate between subjective and objective data, demonstrate effective communication and interviewing skills, apply professional documentation methods. We'll be looking at the SOAP method as well as the ADIME method. And you want to recognize ethical and professional responsibilities when conducting a nutrition assessment. Okay, so video one covers the nutrition assessment. And we're going to be looking here at steps in conducting a nutrition assessment. So we're looking at preparation, introduction and rapport building, the actual interview or data collection itself, data validation, and then documentation. So there are 5 steps. Step one, first off, you want to prepare. You want to understand what is the reason for seeing this patient, what is the reason for this nutrition assessment. You want to review referral notes. So if you are placed at a hospital, you may have inpatient or outpatient referrals to see a patient. Okay. In a private practice setting, you may have inter-practice referrals. So the person may come and say, well, the doctor said I need to see a dietitian, and you can ask for a referral, or you may have your own client form that you have the person fill out to capture information. Looking again, if you get a detailed referral note, that can be helpful. Or you also have your clients fill out or your patients fill out a know your client, know your patient questionnaire so that you can gather some information for that preparation. It can help you go into the assessment with at least an idea. Now, not all settings this is possible, but it can be helpful. Step two, introduction and rapport. Don't just walk into that experience with the patient and start rattling off questions. Before the official assessment begins, you want to build rapport because then you're able to build, they're able to get a little more comfortable and build more trust and have a smoother assessment experience. So you want to kindly introduce yourself. You may say what you're there for, depending on again, the setting. Okay. You want to be aware of certain cultural differences and norms and respect them. You would have your beliefs, you come from a certain background, but you're going to be engaging with persons who have different belief systems. You are there to perform your duty as a dietitian nutritionist, full stop. You may even ask them how they're doing and what they expect from the visit. That is a really important question because sometimes you're going to hear a person say, well, I expect you're going to tell me I can't eat, da, 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 right? Or they want to express that. So you want to ask, what do you expect from the visit today? So what do you expect that I may say, or what are you looking forward to learning? Those types of things you want to ask. And it helps them to really open up. And upfront, you would know, well, okay, this is where this person's head is at, this is where their mindset is, and this is how I need to move forward as well, navigating and managing that. The assessment, interview, or data collection itself. So you're systematically going to ask questions based on the assessment form that you have to gather as much pertinent data as possible. So you ask things like date of birth, because again, you can have persons or end up with persons with the same name. I've had that experience, and different people, same name. So you want to always gather their date of birth. You want to ensure you have a list of their medications and supplements. Ask the question: are you taking any supplements, any multivitamin or herbal supplements? You want to understand gastrointestinal symptoms because that's a big indicator of what's happening with them from a nutritional perspective and how we need to move forward. You want to understand their dental health and history. Do you have dentures? Do you have teeth that hurt? Are you missing teeth? Physical activity levels, and then complete your diet recall as well. And if it's something in person, you do a nutrition focused physical exam. You also want to have a concept here. We can understand the difference between subjective and objective information. So, or data. Subjective data is patient reported information. So, when they say, I feel tired, I have dizziness, my appetite is low, my appetite is high, and some of their food beliefs, all of that is subjective data. Objective data, however, would be measurable or observed data. So we're talking about the lab results, their height, their weight, grip strength, physical exam findings are objective. And understanding the difference between subjective and objective data will be very beneficial for you in completing a client note, particularly in the SOAP format, because SOAP is subjective, objective assessment plan, right? So you know how to list that those bits of information based on distinguishing between subjective and objective data. When it comes to communication as well, we want to have what is known as active listening and ask open ended questions. Okay, so you want to listen and reflect. Motivational interviewing is a style that you would learn more about as well. But you ask, can you walk me through what you ate yesterday? Right? Um, they say, what okay, so what I'm hearing is you had two slices of bread. Is this typical for you? You want to ask things in a particular, you want to actively be listening, not just writing down and not processing. You want to listen, process, and write. You want to have be able to ask culturally sensitive questions. What foods are more important in your household meals? Okay, how important is this? Is this a daily something that you consume daily? You want to understand those things. You want to have a non-judgmental tone when discussing weight, eating habits, or sensitive topics. So you're not going to say, "That's your weight? Huh, that's what you eat?" No, 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 no. Dietitian nutritionists, you need to have a non-judgmental tone when interacting with your patients, especially around sensitive things or things that can leave a lasting negative impact on them as well. And you want to continue to foster the strategies to build trust, showing empathy, acknowledging certain challenges that they may have, such as cost, access, and lifestyle, can be really beneficial in having a successful assessment interview. We want to acknowledge ethics as well during the interview. So ensure confidentiality. Patient data needs to be protected. If you're in a hospital setting, you may discuss some of these things with your colleagues to get some information about a patient, but sometimes you may even omit the name if you're just trying to get some bits of information. You're in a private practice, you don't go around saying Miss Lisa from so and so has this. No. Confidentiality is very important. You want to obtain informed consent before the assessment. So although you've gotten a referral, they may have come to you because there's a referral. So okay, can I this is what's going to happen. This is what I need to do. Is that you can expect me to ask a series of questions based on my assessment form. You want to let them know what to expect for the assessment interview. Because sometimes if that's not done, they may be like, how come they're asking me all these questions? How is this relevant? How is this pertinent? You want to be able to help them understand. Okay, so you want to ensure that you have obtained or at least informed them of what to expect in this assessment interview. You want to be culturally respectful and avoid imposing your personal preferences and thoughts and beliefs onto them, and remain as objective and evidence based in your interpretation as possible. Step four, data validation. And here, you want to be able to cross check the data that you have collected for accuracy. So verify units. Is it really 120 pounds, 120 kilograms? You want to understand, did I collect or did I write down the correct things? Review the diet record for completeness and accuracy, right? Maybe there's the opportunity to return and say, hey, I missed how many slices of bread do you typically have at breakfast time? Something along those lines. So you want to make sure that it's complete and you want to determine which labs are high, low, or within normal limits. So you have a concept of that. Is this person's hemoglobin levels within normal? Are they high? Are they low? Like you want to be able to then look at the patient's labs, compare them to the comparative standards, and then understand how do these labs rank. And then documentation. So documenting the patient's notes in a standardized format helps to ensure clarity, continuity of care, and legal protection because it means that you have represented your process well on people. Okay, so SOAP notes stand for subjective, objective assessment and plan, and ADIME notes assessment, diagnosis, intervention, monitoring, and evaluation. So the SOAP notes we say are more old school, and ADIME is more of the updated way that the academy would want to see dietitian nutritionists represent their assessment and plan for a patient. So let's look at a case application of completing a nutrition assessment. Sarah is a 23-year-old university student, and she presents with fatigue and frequent colds. She eats mostly instant noodles, fried chicken, and soft drinks, and reports skipping breakfast. Her height is 165 centimeters, weight is 50 kilograms. She has a BMI of 18.4 and a hemoglobin level of 10.8. So pause and answer these questions before we move on. You want to identify the subjective and objective data in Sarah's case. Write a short SOAP or a DIME note based on Sarah's case. And really the nutrition assessment aspects of this, because we've only been covering nutrition assessment, so you wouldn't know how to do a full note just yet, but you want to take a shot at it. And then suggest which nutrition concerns should be prioritized in the management of Sarah's case. So go ahead and pause and start brainstorming your ideas around these things, and then you would review it. Come back when you're finished to review this together. So, looking at the SOAP notes in Sarah's case, so the subjective information is that she has reported, because subjective again is patient reported information. So, she reported fatigue and frequent colds. She often skips breakfast. She relies on instant noodles, fried chicken, and soft drinks. And she may have also reported limited fruit and vegetable intake. Objective information: a height, weight, BMI, and hemoglobin, which is low. For females, it should be at least 12, 12.5 in some labs. The assessment here, and we're identifying for the SOAP node, the assessment is looking at what are the nutrition related problems. So we're seeing possible iron deficiency anemia based on her low hemoglobin level, fatigue, and a diet, at least based on this brief diet recall, that is low in iron rich foods. And then there may be a low dietary variety and limited micronutrient intake. She's a university student, likely is not working, has limited income, and therefore her diet will reflect that, and her nutrient deficiencies would reflect that as well. So the plan that you may come up with might entail recommend increasing iron-rich foods. Okay, so we're looking at peas and beans, lentils or peas and beans, leafy greens, dark green leafy vegetables, so pak choy, bhaji, watercress, kale if you so like it. Okay, callaloo bush, dashing bush, right? Those leafy greens, lean meats, and fortified cereals. Encourage pairing plant based iron sources with vitamin C rich foods as well, because vitamin C can enhance the iron absorption from these foods. You want to discuss the importance of balanced meals, including breakfast. And you want to suggest a referral to a physician for further anemia workup and management. So if she's a student on campus, you may refer her to or encourage her to visit the campus medical services, right? Or if she has a family doctor, maybe you have a list of physicians that you can recommend. And then you plan a follow up to monitor her intake symptoms and lab values as well. So this is the soup. So we get to see the way that it is laid out. We're looking at the subjective information first. So you're trying to understand what's happening with this patient based on what they have reported. Then we start to look at the objective information, which would be anthropometric information as well as labs. And then the assessment is where we starting to really pinpoint what are the nutrition related problems that this person is experiencing. And then in our plan, we start to say, well, this is what I, as a dietitian, can do to support her. Okay. Looking at it from the ADIME perspective, it's a little bit different, where the assessment is going to be a combination of subjective and objective data. And in this assessment, we are looking at the anthropometric data, biochemical, clinical, dietary, and others. So the others might be a lifestyle review. She's a busy student. Okay, the biochemical, her hemoglobin is low. Clinical, she has fatigue and frequent colds. If you did an NFPE, the results of that will be listed here as well. And dietary, she can skip meals, diet is high in processed foods, low in iron, fruits and vegetables. And then you come up with a nutrition diagnosis. The next video series will be focused on the nutrition diagnosis, but this is an overview. And here we're looking at inadequate iron intake related to poor dietary variety, frequent meal skipping as evidenced by low hemoglobin level, or you could even state it here, low hemoglobin level of 10.8, fatigue, patient reported fatigue, and limited intake of iron-rich foods. another potential nutrition related problem that we've identified and stated in the problem in the format of the PES statement: inadequate intake of fruits and vegetables related to dietary habits, as evidenced by diet recall and frequent cold, suggesting a low micronutrient intake. Okay. And then with the ADIME, we are looking at the intervention. So, what are we going to do? How are we going to help her? Right? And the intervention needs to be based on the diagnosis that we came up with. So, the two that we looked at here: inadequate iron intake and inadequate fruit and vegetable intake. So, how are we going to address those? Nutrition counseling to increase iron rich foods and incorporate fruit and vegetables daily. So you may provide a list of iron-rich foods, show and from speaking to somebody who's a university student, identify practical, budget-friendly ways for them to do this. You would look at education and balanced meal planning, including quick affordable breakfast options. And you want to look at strategies to reduce the reliance on instant noodles or fast food by meal prepping and simple alternatives. Or you may even get a little creative and say, well, okay, what can we add to the instant noodles to make it more nutritious? Because maybe the instant noodles, from a budget perspective, it's what's available. And so we can add other food groups to that to make it more of a wholesome, nutritious meal that can support a fruit and vegetable intake, well, in this case, vegetable intake, as well as the increased intake of iron rich foods. Okay. And then monitoring and evaluation. How do we track the progress? How do we know if she's meeting her goals? You want to track hemoglobin levels that follow up. You want to monitor dietary changes through the food recall. So you do another food recall, or maybe even having her do a food log, a food record, and be able to identify, has she been making certain changes. And then you want to reassess her energy levels and the frequency of illness at the next visit, because that can be indicative of her micronutrient intake. So what we're seeing with the ADIME and SOAP formats is that both of them can lead to the same clinical direction, but there's a different emphasis. So the SOAP is starting off with acknowledging, what did this patient say is happening? And it's more focused. It's just bam, bam, bam. What's happening? What did she say? Okay, what is the objective information? All right, this is my assessment. With ADIME, we get to expand on some areas a little bit more, and it's really focused on the development of nutrition diagnoses. So, as dietitians, we don't diagnose from a medical perspective. We're not going to tell somebody, you have diabetes, that's what the doctor. But we will now use that information to come up with a nutrition diagnosis that defines the nutrition related problem that we want to prioritize, because we're going to base our intervention on that nutrition diagnosis. Okay. So that's it for this nutrition assessment lecture series. And next up, we're going to be looking at the nutrition diagnosis lecture series, where we identify and prioritize nutrition related problems for personalized nutrition plan or intervention.